Greetings. My name is Dr. Roger Cohen, and I'm here today with our discussion, a low-carbohydrate and ketogenic diet as a treatment for anxiety disorders and behavioral disorders, looking at it through a review of literature this time. Now, I know that many of you think when you hear the word ketogenic diet, it conjures up images of lots of bacon, butter, maybe a bad diet that's passed or that you're thinking you're fearful of. You've seen it on social media. What I hope today is to look at that there's some serious peer-reviewed science there, and using some of these dietary approaches in our mental health treatment of people, and looking at the neurobiological rationale for helping people is actually quite compelling. So today we want to look at a few areas. We'll start with context, the mental health crisis. Then we'll look at why we need some new approaches. Then I'll give you a quick definition of what these diets are. From there, we'll go into some mechanisms of why the diets work on the brain, and then we'll look at things like anxiety disorder, ADHD, and autism spectrum disorder with a low carbohydrate diet. So let's start with the problem. 1 in 5 is mentioned in the top. There are 3 numbers to tell in our story here. 1 in 5 American adults experience some sort of mental illness each year. Between 30 and 40% of patients with anxiety disorders don't respond adequately to first-line treatments. So medications and therapy are those first-line treatments. So 1 in 6 children between the ages of 6 and 17 are diagnosed with a mental disorder. So these numbers are stark and rising. The global burden of mental illness is rising, even as we have more medications and more therapeutic techniques and more modalities available than any point in history. There's a paradox: more tools, more suffering, and is a driving question right now. And is there other alternative ways that we can be looking at treatment? So the core proposition here for this is, are any of these therapeutic techniques allow having positive treatment for metabolic pathologies of people? So we want to look at things like, is there an impairment of glucose metabolism in the brain or chronic neuroinflammation, and do other things help fix these problems causing other issues within people. And so let's start with this idea of diet. Will the low carbohydrate and ketogenic diet be beneficial? So before we go further, let's make sure we're using these terms very precisely, because research literature is actually inconsistent. So people have been using them inconsistently. So a low carbohydrate diet, which is the one I put on the left, typically limits carbohydrates to 50 to 130 grams per day. It's considerably less than the average American consumes, which is usually over 300 grams of carbohydrates. But it doesn't necessarily induce a state of ketosis just because it's a limited carbohydrate diet. It reduces blood glucose volatility. It lowers insulin. It reduces the inflammation in a person, but the liver may not produce significant ketone bodies within a person. A ketogenic diet, the one that we see on the right here, goes much, much further. We're talking about typically less than 20 to 50 grams of carbohydrates per day. And the source of energy is fat, making up to 60 to 80% of calories within that energy intake. So fat makes up to 80% of these calories for a person. At this level of restriction, the body shifts its metabolic strategy entirely. The liver begins converting fat into ketone bodies, primarily BHB, and along with other acetone, these ketones become the primary fuel of the brain. So the ketogenic diet isn't new. It was developed in the 1920s, a century ago, and it's a treatment for drug-resistant epilepsy in children. And the origin story turns out to be very important for understanding how the researchers and why the researchers started looking for it in other therapeutic settings. So this turns us to looking at this idea of neurobiological mechanisms. So why would changing what you eat affect your anxiety level or your child's behavior? So the answer lies in 5 converging neurobiological mechanisms. And I want to walk through each one of these briefly, not in depth. So the first is the GABA and the glutamate balance. These are the brain's primary brakes and accelerator. Anxiety is associated with too much glutamate, too much excitation, and not enough GABA, not enough inhibition. So ketosis shifts this balance towards inhibition. The second is neuroinflammation. So chronic low-grade inflammation in the brain is now recognized as transdiagnostic and future of anxiety. So it represents anxiety also, and depression, and ADHD, and even autism spectrum 1. So ketone bodies, particularly BHB, have a potent anti-inflammatory properties that will help with neuroinflammation in the body. The third is the mitochondrial stabilization. The brain is the most energy-hungry organ within the body, and when there's an increase in mitochondrial malfunction, it's usually documented and seen, let's say, in disorders like autism or ADHD. The brain's energy supply becomes unreliable, and so ketones provide an efficient alternative fuel for that period of instability. The fourth is, I'm going to call it the gut axis, the gut-brain axis. And the ketogenic diet substantially reshapes the gut microbe, the microbiome, and the gut talks to the brain consistently through neural, immune, and endocrine pathways. And so there is this important area to which the ketogenic or low-carbohydrate diet will help with the gut microbe. The fifth is the blood glucose stability, which rapid swings in blood sugar can trigger, of course, cortisol release and your nervous system activation, the sympathetic nervous system activation. And these are the same psychological systems that drive anxiety within a person. So eliminating the carbohydrate-driven spikes removes some anxiety triggers within people. And these are some of the research evidence that we're starting to see come out of research. I'll show some of this research in just a few minutes. But so let's first look at some of this and walk through the diagram right here of the GABA and glutamate deep dive. So we'll take a moment right here, and we're going to look at how the GABA glutamate mechanism is most well characterized and has the most direct clinical relevance for anxiety. So a carbohydrate restriction will induce ketosis within a person, and which increases the ketone body production, particularly BHB. So, and ketosis, the support cells of the brain become more metabolically active, and they convert to glutamate and into glutamine more effectively, and then that glutamine then gets shuttled into inhibitory neurons, which convert into GABA. So result more inhibition, less excitation, calmer neural activity. So there is a very strong correlation between using drugs like Xanax, Valium, which are GABA receptor activity drugs. And so there's a parallel through a natural cause to pharmaceutical intervention. So the ketogenic diet may achieve a similar effect through metabolic means rather than pharmaceutical ones. There were 3 studies that supported this in my review when I was looking at it. The Udkoff and colleagues published in 2008 with epilepsy research showing conversion through ketogenic brain tissue. The Bazari confirmed this in 2023 in Cell Discovery, and the Needham and colleagues 2023 was looking at bipolar disorder and the daily ketone diets for reduced anxiety disorder in people. There is actual clinical evidence for anxiety disorders. So the most comprehensive review is the Deitch and colleagues published in the BJPsych Open 2023 research. They looked at 4 major databases, Medline, Embase, PsycInfo, and Cochrane, and identified 12 studies involving 389 participants that met the inclusion criteria within their study. And they ranged from case reports to cohort studies, and the quality of evidence was variable. But across all 12 studies, the direction of the findings was consistent. Every study trended towards a benefit. And Varay and colleagues in 2023 also went further with a formal meta-analysis published in the Journal of Affective Disorders. They showed statistical significant reductions in anxiety scores among participants with low-carbohydrate diets compared to controls. So these initial research findings are showing for positive research and for anxiety control. So we then have to look at ADHD. Approximately 10% of children, about 6 million, are diagnosed with ADHD right now, making it the most common neurodevelopmental condition in childhood. First-line treatment is typically stimulant medication, which works well for many children but carries side effects, concerns, and doesn't help very many people, or it doesn't help, redact that statement. It doesn't help everyone. The research specifically examining the ketogenic diet for ADHD is limited, but suggestive. The Holbrook and colleagues in 2012 published an epilepsy research studied children with epilepsy who were on ketogenic diets and found significant improvements in attention and social functioning. From the preclinical side, Ari and colleagues in 2023 used a rat model of ADHD and found a ketogenic normalized dopamine, serotonin, and norepinephrine levels, and that improvements in ADHD-related behaviors compared to other pharmaceuticals like Ritalin. So comparable to the first-line medication, it seemed to be beneficial for people with ADHD. Mohammed and colleagues in 2021 conducted a study in children with ADHD diagnosis and also using the Conners rating scale, validated clinical instrument. They found statistically significant reductions in symptom severity following a modified carbohydrate dietary intervention. So these findings are really supportive of not just controlling seizures in people with epilepsy, but also controlling the symptoms of ADHD. The next area that's quite interesting needs to be looked at is autism spectrum disorder. In some ways, the most interesting application of the ketogenic diet or low carbohydrate diet for behavioral conditions. So autism spectrum disorder is associated with a cluster of biological abnormalities that map almost perfectly onto mechanisms I've previously looked at with other disorders. So there's high rates of mitochondrial dysfunction, the chronic neuroinflammation, gut microbe issues, GABA defects, and all this co-occurs within people with epilepsy in about 26% of cases, which means the ketogenic diet is already being used clinically in substantial portions of population for people with epilepsy, but the behavioral benefits associated as a secondary outcome in epilepsy trials gave researchers an impetus to study it directly, and the human evidence came off with 3 different anchor studies, what I believe are important. The Evangelo conducted a first pilot in 2023, placing 30 children with autistic behavior on a modified keto diet for 6 months. Of the 18 who completed the trial, almost all showed improvements in social behavior, learning, and attention. The Al-Rashidi and colleagues ran was most methodologically rigorous comparison study to date, randomizing 45 children in a ketogenic diet, a gluten-free and a casein-free diet, and a control diet. Both dietary interventions outperformed control, but the ketogenic diet showed the greatest of overall improvements in that study. Lee and colleagues study in 2018 used a modified ketogenic diet as well, adding medium chain triglycerides for children and 15 children ages 2 to 17, and found a significantly statistical improvement in autism diagnostic scores after just 3 months with a p-value of 0.006. That's a meaningful result for that small study size. So what can we start to take away from this is that autism spectrum disorder with energy metabolism correction, gut microbe normalization, and GABA glutamate rebalancing and anti-inflammatory effects all will be beneficial with one another with a low-carbohydrate ketogenic diet. We can pull back from autism spectrum disorders and other disorder-specific evidence and look at broader clinical evidence. So Danon and colleagues published a retrospective analysis in Frontier magazine in 2022, and it said with 31 inpatients with severe refractory psychiatric illness, schizophrenia, schizoaffective disorders, bipolar disorder, major depressive disorder, people who had already failed multiple treatments. They were placed on a ketogenic diet during their inpatient stay, and their results showed a significant improvements in psychiatric symptoms, global functioning, metabolic health markers. So even with the most severe psychiatric or institutionalized patients, we start to see a increase in performance for the person. Stanford Medicine, a pilot randomized control study published in 2024, looked at the ketogenic diet in individuals with serious mental illness, including schizophrenia and bipolar. It was a randomized design and the most rigorous. So the ketogenic diet showed significant and greater improvements than the usual care control group. Norwitz and colleagues in 2020 also published in the current opinion of endocrinology, articulated the theoretical framework that unifies this literature, saying that the ketogenic diet as a metabolic therapy addresses multiple shared pathopsychological mechanisms simultaneously. So unlike single target drugs, it works on 5 or 6 different mechanisms within the body at once. So that hypothesis is driving research agenda for them and also for future study of other people. So there are limitations, of course. There is intellectual honesty is essential because evidence quality, it's developing. We're getting newer studies that need to expand. The current literature is dominated by case reports, small cohorts, and animal studies. The second is dietary adherence. The classical ketogenic diet is extraordinarily restrictive. Dropout rates are high from people who drop out of a ketogenic diet. Most people will shift to a low carbohydrate diet for maintenance of their low carbohydrate diet. And then people turn to modified Atkins diets or low glycemic diets. But they seem to offer the same treatment for people with the same benefits. And third, confounding when a patient goes on a ketogenic diet, when their anxiety improves, is it ketosis specifically, the weight loss, the elimination of processed foods, the psychological sense of control and of agency as the person has gained autonomy and they're doing better. These are difficult to take apart and disentangle from one another without well-controlled trials. So there is that issue of mental health improvement that needs to be sorted out in the future. Fourth, safety. So potential effects include kidney stones, growth concerns in children, gastrointestinal distress for people who go onto a very strict ketogenic diet. However, as we looked at the fourth one before, when people lose significant amount of weight, what is the true cause of gain and also the of concern. And the fifth, individual variability. Not everyone responds the same way. So gut biome may change by people, and also what biome you have in your gut. And so we have to look at these variances in people and also in these studies. So where does it leave us? For a clinician, I would suggest who have treatment-resistant anxiety, ADHD, and not responding to stimulants, autism spectrum disorder with significant behavioral comorbidities. I believe it's worth giving a try into using a low carbohydrate or ketogenic diet. And if a patient or family is interested, talk to your dietitian, talk to your therapeutic nutritionist. But I assume that there's a place for you to find treatment in such a manner of diet control. On the right, for researchers, I think the agenda is clear. We need to have a little bit more standardized dietary protocols for verification of ketosis, and not just self-reporting, because that, of course, can be variable on how well someone's in ketosis. And those are variable problems of maintaining ketosis for people. So what do we take away? 4 things for you to take away today. First, Low carbohydrate and ketogenic diets will look at a multiple well-known pathophysiological features of anxiety, behavioral disorders, and they are beneficial. Second, the evidence is promising and consistent across ADHD, anxiety, autism, but they're limited in design, point in the same direction. It's meaningful that it's not replacement for other treatments. It could supplement and help when there is a problem with treatment. And fourth, medical supervision is not optional. Even though ketogenic diet is a therapeutic intervention, you need monitoring to make sure that you are balancing it with other mental health treatments that you are doing. This is the literature that we are looking at today. I would like to thank you for watching and being a part of this. And until we come together again, I look forward to that time that we can converse again.